Hi, welcome to this session on introducing the new professional standards for speech pathologists in Australia. I'm Simone Arnott, one of the Senior Advisors of Professional Standards at Speech Pathology Australia. First, an acknowledgement of country. We acknowledge the traditional custodians of lands, seas and waters throughout Australia and pay our respects to elders past, present and future. We recognise that the health and social and emotional well-being of Aboriginal and Torres Strait Islander peoples are grounded in continued connection to culture, country, language and community. So you're here today because you'd like to know more about the new professional standards for speech pathologists in Australia. We're really excited about this new document that will underpin a number of core areas of practice that we do at Speech Pathology Australia, and it will be a document that should be very important to you as a practicing speech pathologist or as a student studying to become a speech pathologist in Australia. The professional standards will eventually supersede the CBOS, or the competency-based occupational standards for speech pathologists, and many of you will be very familiar with the CBOS document, which was first developed in 1994, so quite some time ago. It's had several revisions over the years in 2001, 2011 and 2017, and so it was time to revise the CBOS, and we have eventuated with, or what has eventuated is the professional standards for speech pathologists in Australia. So there are a number of reasons why it was time for a revision, and they're listed on the slide for you there, but it was very important for Speech Pathology Australia to improve services to Aboriginal and Torres Strait Islander peoples, and I hope that when you read through the professional standards, you'll really notice an increased amount of content related to Aboriginal and Torres Strait Islander peoples and how that content is integrated throughout the document as opposed to being an additional layer that you would have seen in the CBOS. So it's very integrated throughout. We have also seen lots of change in our profession across the last several decades, and so with those scope of practice changes, it was time for our professional standards to represent or to acknowledge those changes that have happened in what we do as speech pathologists in Australia. And the profession had been telling us for a while that they couldn't always see themselves in the CBOS, so they couldn't even see themselves in those range of practice areas that were defined in the CBOS. And so you'll find in the new professional standards there are no range of practice areas, but it talks about communication and swallowing. So we really hope that speech pathologists will be more readily able to see themselves within the document, and that it represents the changing scope and breadth and depth of the work that speech pathologists do in Australia, as well as having a much more increased focus on working with not just individuals but also with communities, and the work that we do around advocacy and prevention and promotion, in addition to doing the diagnostic assessment and intervention work that we're very familiar with. SPA 2030 project was a landmark project for Speech Pathology Australia some years ago. It's still got a lot of time left in it, and the SPA 2030 project defined a number of aspirations that are very important for us moving forward, and so the new professional standards really have aligned themselves with a number of those SPA 2030 aspirations. We're also a member of the National Alliance of Self-Regulating Health Professionals, or NASRAP, and NASRAP have particular requirements that they need us to abide by as members of NASRAP, and so looking at our standards and revising them was also part of that requirement, as is SPA policy requirements around review periods. So it was timely to conduct a revision and to look at the requirements that we have for our members, but what it is that speech pathologists do in their work in Australia now and into the future. You may also be aware that the Code of Ethics has been revised, and it's being launched in October 2020. And so the development of the professional standards was also timely because it linked in really beautifully with the revision of the Code of Ethics. And those two documents are very important to each other. They actually walk hand in hand, and they require each other to function well. And so when you are looking at the professional standards, it certainly refers to the Code of Ethics, and likewise the Code of Ethics refers to speech pathologists aligning themselves with the professional standards. So it's important that you're familiar with both of those documents. Now, the professional standards didn't just come to pass by a few of us at National Office developing some standards. No, it was a very large consultation process and was conducted by a team of people led by Gretchen Young and Associates of Young Futures. So Gretchen Young and her team started developing the professional standards, which at the time was called the CBOS Review, mid to late 2018. So it's some years ago now that all began, and you might remember being asked to complete a survey about what you think about the profession and where you would like us to be heading with regards to standards. So there was a number of different phases around the CBOS review, and they're on the slide there, but you can read more about the CBOS review on the Speech Pathology Australia website under the CBOS tab. So there's still a lot of content on the website to talk about the journey of development of the new professional standards. But there was certainly a significant amount of consultation that happened, surveys, consultation, webinars, seeking public feedback, and comments on the draft documents. So please, if you're interested in knowing how they have been developed, please pop into the website and have a look at the documentation around that journey. Now we are in a new phase for the professional standards. So they were introduced during Speech Pathology Week 2020, and there was quite a lot of publicity around the new professional standards, and we're now sitting in a phase that we're calling the socialization phase. So that means it's a time where you can get to know the standards, that you can pass them around, that you can talk about them, touch them, feel them, take them to your staff meetings and your team meetings, and think about how the professional standards apply to you and your teams relevant to the context and roles that you work in or are doing as a speech pathologist in Australia. So this socialisation phase will occur from now through till December 2020. So we've got a little while to get to know the standards until they are then implemented for members on the 1st of January 21. So that date is the save the date, or the important date to remember is the 1st of January 2021 will be when the new professional standards will be the requirement for members to align with. We can't just roll out new professional standards against all of the sorts of core business that Speech Pathology Australia does and works with, because we have a large number of things that rely on our standards and currently rely on our CBOS. So things like university accreditation, when we're looking at or assessing re-entry applications, so when people are returning to practice and are part of the re-entry process, and also for our overseas qualified speech pathologists who are wanting to work in Australia. All of those different areas rely currently on the CBOS. So we have a large number of implementation projects underway to work out how the new professional standards will apply to those areas of business that we have, and what changes might need to be implemented during a period of time to ensure that people can comply and know what they need to do in the transition period between CBOS to professional standards, and then fully integrating into using the professional standards. So you can watch this space if you are in one of those groups, but lots of our question and answers on the web also address those kinds of areas. I'm assuming if you're joining me today that you probably found us via the Learning Hub, but if you didn't, you will find that there's a lot of content on the professional standards via the Learning Hub, so you can kind of do a course in the professional standards. So just click on the professional education link on the website, it will take you to the Learning Hub and you can click on professional standards. And when you're there, there'll be a whole range of different activities that you can engage in to find out more about the professional standards. But I will suggest that some of the video content is really important to watch. So you can see on the screen there's a lovely picture of Sue McAllister, and Sue has presented 2 videos on Compass and use of the professional standards with Compass. So if you're a student or a clinical educator or someone that works in a university setting, that might be really relevant and interesting to you. And she also talks to us about using the professional standards and how they reflect the future growth of the profession. You'll also find videos from our CEO, Gail Mulcair, our National President, Tim Kittle, and from Eddie Ong, who's a member of our Aboriginal and Torres Strait Islander Committee. There's also a number of Q&A cards that you can flick around and find answers to some common questions and a range of other materials, as well as some downloads. So the good news about the new professional standards for speech pathologists in Australia is that it's reflecting the minimum standards of what we're expecting all speech pathologists and graduate students to be able to do. So given that it's the minimum standards and you're a practicing speech pathologist or you're about to graduate, we actually expect that you'll already be meeting the standards. So we're not expecting for many people that they'll have to be doing anything much different at all, but we do expect that people will be familiar and become familiar with the professional standards and what it means for them in their context and their role. We do think that the professional standards will help clients to know what to expect from a certified practicing member. So you will be able to use the professional standards to promote your quality service. It's certainly a much easier to navigate document. It doesn't have the layers that the CBOS had, and we hope that it will be a document that clients will find helpful to show them what they can expect from a qualified speech pathologist who's providing minimum services or more. As I mentioned briefly before, the Compass is a workplace assessment. It's a valid, standardised, standalone tool, but the Compass assesses competency for students on workplace assessments or workplace placements. And even though the Compass uses a lot of language that's very similar and aligned to the CBOS, we expect that you'll be able to continue using the Compass during workplace assessments for many years to come. So competency assessment hasn't changed. The Compass still accurately gathers information and helps to define what level students are functioning at when they're on their workplace assessments or their work placements. So you can continue to use the Compass as you already have, even though the language is different to the professional standards. And in fact, over the years, there's been much confusion about what's Compass and what's CBOS, and so that we actually anticipate it will be nice to have some differentiating terminology between the professional standards and the Compass. So the professional standards will define the minimum standards for speech pathologists in Australia, but the Compass will continue to define different competency levels when students are on their placements. So as I said before, this is just an introductory and socialization phase, and you have time to think about how the new professional standards apply to you and your teams before they come into effect on the 1st of January 2021. If you had a good look through the professional standards, you will know about the structure and the layout. If you haven't had a good look at them yet, you'll notice that there are 3 domains. So the 3 domains are professional conduct, reflective practice and lifelong learning, and speech pathology practice. All of the things that speech pathologists do, depending on their context and their role. Those 3 domains are then divided into 20 different standards, and there's a different number of standards for each domain. And then each standard is further broken down into elements. And all of the elements start with a we statement, talking about what we as speech pathologists do. So it's not a multi-layered document, as I mentioned before, like the CBOS was. It's quite easy to navigate, and that overview page that you'll see there on page 10 of the document might be something that you might like to print out and laminate and have even at your reception area, or for clients to understand what it is that speech pathologists do in Australia. So people have been asking us to provide them with a compare and contrast between the CBOS and the professional standards. They are quite different documents. We haven't just revised the CBOS, they're very different overall. But one of the main differences now is that the CBOS was used to define entry-level practice for graduating speech pathologists and for overseas qualified applicants. So for speech pathologists who qualified overseas and were keen to be working in Australia. So it was really used to define that entry-level point to entering the profession in Australia. The professional standards, however, apply to all practicing speech pathologists in Australia at any point in your career as relevant to your role and your context. So it's not just a document for graduating students, it's not just a document for overseas qualified speech pathologists or for speech pathologists re-entering the profession after a career break. It applies to everyone all of the time, no matter whether you've been working for 2 minutes or many, many, many years. It must be read, as I said, in conjunction with the Code of Ethics. And I also mentioned this before too, that there are no range of practice areas specified in the new professional standards. It just talks about communication and swallowing. So those range of practice areas that were specified in the CBOS, which was the speech, language, voice, fluency, swallowing and multimodal communication, are no longer going to be the way that we define what speech pathologist areas of practice are. As I also mentioned, the CBOS used to have a number of different components. So it had a professional framework, it had practice principles, it then had its range of practice areas, and the CBOS units and elements, which are those components that align very closely to the compass. Whereas you've already seen that the professional standards just defines the domains, the standards, and the elements. There are no measures in the professional standards, so you won't find performance criteria and cues regarding what constitutes entry-level performance as we had in the CBOS. So we anticipate as we move forward with our implementation projects for areas such as university accreditation, where it's very important to define what constitutes entry-level practice, and for some of the other areas such as re-entry and overseas qualification assessment, that we consider we might need to develop some measurement requirements that might sit as an additional or supplementary document to the professional standards. But those projects are underway, as I said, and so I can't tell you what they're going to look like because we're not really sure yet. So you will see that there'll be some transition periods for those areas of where we require measurement, and that will be rolled out as those projects come to completion, and we'll keep you very posted if you are a stakeholder in one of those areas. There are some responses in the Q&A area on the Learning Hub that also refer to students, university people, and people who are looking at OSQ or re-entry. So please have a look at those and contact us if you've got any further questions. So thank you very much for your time today. We hope that this has been informative and given you some insights into how we got to where we are now. We're very excited about these new professional standards for speech pathologists in Australia. We're very excited that it's been a collaborative process that's really acknowledged the concerns or the limitations and the changes that were required to acknowledge where we are now compared to where we were before, and to where we're going, recognising the SPA 2030 aspirations and all of the developments that have been happening in our profession. So if you've got any further queries, please don't hesitate to send us an email and ask those questions. There's also a link on the Learning Hub so that you can ask more questions, and feel free to contact us if anything's unclear. We really want you to enjoy this socialization time, get to know the document, and think very carefully about how all of the areas of the professional standards apply to your context and your role. And as I said before, there'll be a number of, or there might be some things in the professional standards that don't apply to you right now because of your context or role. So for example, if you're someone who doesn't do any research whatsoever in your role, then any of the standards that relate to research won't apply to you because they don't apply to your context or your role. If you are in an assessment-only type of workplace where you only assess clients, then any of those standards or elements that relate to providing intervention won't apply to you because that doesn't apply to your context or your role. So it's really important that you use this time to talk with your teams, perhaps create a team meeting that's just to talk about the professional standards and which areas, what it is that you do in your context and as part of your role, and how you can see yourself or not within those areas of the new professional standards. So do spend some time getting to know it so that when the standards are applied as of the 1st of January 2021, you can feel really confident moving forward and then looking at your renewal for membership in July of 2021. So we look forward to working with you. We'll continue to provide updates through all of the different channels of Speech Pathology Australia, and drop us a line if you've got any further queries. Thanks so much for your time.